everyone, and welcome back in Eye and Health. We're here to talk about one of the most common type of treated heart arrhythmia, AFib, right? And some people really don't know that they have AFib. Some people don't even know about the symptoms. Others just live with it every single day. Here to tell us more about this heart condition, we have the clinical cardiac medical director at Jupiter Medical Center, Dr. David Weisman. Thank you so much for joining us. This is scary because people don't realize that they have this. First, talk to us about what atrial fibrillation is.
Very well said.
Thank you.
So atrial fibrillation is one of the most leading arrhythmias in the United States and worldwide. It's really a growing epidemic. It causes a lot of problems. Patients really feel bad. They feel short of breath. They feel like their heart is racing. They may get dizzy, faint, and feel just generally tired. Even worse, they can suffer stroke. Blood clots can form in the heart and travel to the brain and cause damage there. In addition to that, patients who have AFib can suffer from things like a heart attack or even heart failure.
Wow, and this is so common. Millions of people have this. What do you want our viewers to know, doctor?
I mean, atrial fibrillation is a serious condition. I think if you're experiencing any of those kinds of symptoms, you really ought to get checked out. Go see at least your primary care doctor or even a cardiologist. What you need to have done is an electrocardiogram, an EKG, and perhaps even a monitor done to make the diagnosis.
Is there any misconceptions out there? I mean, some of the symptoms are pretty common for like stroke, for example. How do they know they have this? I think getting it tested obviously helps. But anything that you want to just tell our viewers about this condition, because it's so common, just some of the common questions that people ask when they realize, because they can mix it up with possible stroke, for example.
Right.
So tell us a little bit about that and also the help that's being offered in our area.
Right. So I think first and foremost, you need to make the diagnosis.
Yes.
And if you have that, you have to take it seriously. This is really a lifelong condition that needs to be treated just like anything else, like diabetes or high blood pressure. Thankfully, we have really good treatment options. First and foremost, you need to do the right things, which is exercise, lose weight, don't smoke, cut back your alcohol consumption, those kinds of things. Beyond that, there's always conservative treatment. So we have medication options. Those are not uncommon to be tried first, but many patients who end up coming to see myself, for example, will be offered minimally invasive type of treatments, something that we call catheter ablation. So this is kind of a minimally invasive treatment where we can insert these catheters in from the groin and basically try to cure the heart of the AFib.
So clearly there's so many benefits from this as well. What are some of the procedures? Anything else that you want to share, just some of the benefits of the procedures that you guys do at Jupiter Medical Center?
Right. So recently we've been exploring and doing a relatively new type of procedure we call concomitant or combined AFib and something that patients like to call the Weisman procedure. So this is a procedure to treat that heart rhythm disorder and also get them off the blood thinners, that medicine that's going to prevent the next stroke for them.
Really interesting topic here. Anything else you want to share with our viewers?
I mean, many of the patients who undergo these treatments really feel better afterwards, and many of them are happy about it. I think from a procedure standpoint, it's minimally invasive. Now we're able to offer these kind of combined procedures, so it's less recovery, it's less cost, it's less anesthesia, obviously. So it's all things you want to hear as opposed to having many different procedures to treat one condition.
Well, it's great to know that this is some of the things that's being offered at Jupiter Medical Center and that it's treatable. But most importantly, listen to your body and get diagnosed first and see what's going on. So, doctor, thank you so much for being here, and we'll be right back.